Thank you for choosing Physicians Primary Care Pediatrics. It is both an honor and a privilege to be entrusted with the healthcare needs of your child. One of the greatest joys in pediatrics is watching a baby grow into a child, helping them navigate those awkward adolescent years, and then celebrating their journey into young adulthood. It is our goal to partner with you in helping your child negotiate through each of these stages healthy and successful. One way to keep your child healthy is through routine vaccinations. There are very few medical accomplishments that have done more to decrease childhood morbidity and mortality than vaccines. Older generations have experienced fears we thankfully don't have to face. My own mother has told me about parents in the 1940s who would not let their children in large crowds for fear of contracting polio. Imagine the joy of watching your bright young first grader learn to read turn into utter devastation. That's what happened in the 1960s to my sister's classmate when encephalitis due to measles left this little girl brain damaged. When I sent my son off to school, I certainly thought of reports of meningococcal outbreaks on college campuses and felt safer knowing that he had been vaccinated. Today, we are thankful for vaccines that can prevent 3 types of bacterial meningitis: measles, polio, and many other illnesses. The CDC estimates that vaccinations will prevent more than 21 million hospitalizations and 732,000 deaths among children born in the last 20 years. Yet the subject of childhood vaccinations is still a concerning topic among parents of today. You may be wondering about the safety and effectiveness of vaccinations. We encourage you to discuss your concerns and questions with your pediatrician. The American Academy of Pediatrics, in partnership with the CDC, has an established vaccine schedule created to administer vaccines at the most optimal time for protection. However, I know the concern and anxiety many parents understandably feel about their baby getting shots. Oftentimes a parent will ask if these shots are really necessary, or can they be delayed? Yes, vaccinations are necessary because they protect children from serious and preventable life-threatening diseases. The recommended schedule should be followed. Why? Well, extensive research has been conducted so that children can be immunized at the time they are most susceptible to suffering devastating effects from a disease. For example, whooping cough can be fatal in a baby while only causing a persistent cough in an older child. Parents might ask whether it is safe to give so many shots at the same time. The answer is yes. Multiple vaccines will not weaken or harm the immune system. In fact, today's vaccines are safer than the ones we had as children. They work better with the immune system to booster protection. I know the concerns you have over vaccinations are rooted in the desire we all have to protect our children. This is likely one of the first, but certainly not the last, time you will have questions as we partner together to care for your child. At PBC Pediatrics, we welcome your questions, invite you to share your concerns as we share our experience, knowledge, and expertise. Many years ago, an older colleague told me I would be a better pediatrician when I had children of my own. She was right, because as both a pediatrician and a father, I wanted what was best for my own children. I followed the recommended vaccine schedule for my 3 boys, and I would not recommend anything less for your child.